So today, thank you for joining us. We're going to hopefully do a little education around PaperCut in healthcare, share some really great information in that content as we explore it. We've got Matt Buttrey with us. Matt, I'll let you introduce yourself.
Hi, everyone. My name is Matt Buttrey, and I work at PaperCut HQ here in Melbourne. I'm a senior product manager by trade, but I've been the healthcare subject matter expert since 2017 or 2018, and the coordinator of a wider healthcare group since around 2019. Great to be here. I appreciate everyone's time.
Thanks, Matt. And I'm Rich O'Boyle. I work with the ACDI team. I'm a solutions director and manage the central region from a sales perspective. We've been working on this content for over 2 months, getting it sharpened up for the group for today. Feel free to use the chat throughout. Let us know. On the panel side, we have Noah and Jim from PaperCut Technical Services. We also have Ruff from our side and some of our marketing folks. People are here to answer tough questions and respond in chat, and we'll have some pauses to ask questions throughout. We are recording, just so everybody knows. Let's jump right in. PaperCut, tell me a little bit about PaperCut as a whole and then how we get into healthcare today.
Yeah, thanks, Rich. We've been in operation for around 30 years. Our early success was in the education market, but our feature set is really well suited to healthcare because of compliance and security reasons. We've had a dedicated team working on this particular vertical since 2019, which is a cross-functional group in the organization, everyone from engineering, product marketing, technical, pre-sales, post-sales, and support. A great story to tell, and hopefully people will have some good key takeaways from the presentation about our feature set and the suitability to this vertical.
Awesome, Matt. Awesome. We do know PaperCut, obviously, in government and education, been extremely successful there. But naturally, I think just through IT migration and general product usefulness, we definitely exploded into other markets, healthcare being one of the strongest ones. Matt, you shared this data with me. I was taken aback. It seems like we're doing really well from a global perspective.
Yeah, it's an awesome slide. I know you always want your numbers up and to the right. This is a slide about our customer growth. We started around 2009. I think I started with PaperCut around 2012. So I remember those early numbers quite vividly. This shows growth over a period of time, and you can see that our customer numbers are around 6,300 globally, which is a significant number. We know that we've got competitors in the market that are fierce competitors of ours, and their total customer base might only be around the 10 or 11,000. So for us to have 6,300 healthcare customers alone is a significant position in the market. The smaller line that you can see there is around our year-on-year average growth. And as you can imagine, the bigger you get, the harder it is to see those significant growth numbers. But we still show growth every year. And I think it's the fastest growing market for us here at PaperCut at around just shy of 20% year on year. So really great numbers, got a lot to do, but a great story to tell already around growth.
When we take that global snapshot of the U.S. healthcare markets, about 40% of the global healthcare market, according to a couple different organizations. The opportunity is immense. One of the interesting stats I've learned throughout the past 4 or 5 years is all the consolidation within healthcare, driven by obviously external factors, whether it's economy of scale, whether it's just trying to get better around the security and policies to streamline things. But I think it's something like 9 of the biggest healthcare organizations in the US actually have at least 100 hospitals underneath them. So when we start to look at that, it can get to be enormous. But we also look at clinics and smaller offsets of those bigger organizations that can be affiliated or not of the US workforce is in healthcare, which I found pretty astounding as well. So it's definitely a lot of opportunity over here, which probably brings us to why we're talking today. You shared some really great numbers with me around PaperCut's view in the US market. So what do you have to say about this, Matt?
Yeah, this highlights our US healthcare numbers. We've got a great base with 700,000 active users in this space. The numbers are interesting because the ratios are very different to what you might see in other verticals like education, where you have a large number of users versus hardware devices. In healthcare, you see far greater MFD versus user numbers. And I think the previous slide also highlights just what a massive opportunity we've got in this space. So while our numbers look really good and really healthy, and ACDI does an amazing job, the next slide has a little bit more about that, but there are still organizations out there that are considered greenfield, zero print management, which is mind-boggling, right? Considering the compliance and security requirements that sit around healthcare. Already great numbers in the USA specifically.
So this is probably what you're alluding to, looking at functionalities and levels of participation with the product in the US.
Yeah, so ACDI and your resellers above global average when thinking about feature usage. However, we've still got a long way to go when adding value within your customers' sites. But I guess that's why we have these education sessions, and let's hope it's only the first of many to make you comfortable, and why mobility print and print deploy are really important in those spaces. You can see pretty good numbers there, but we've got a lot of work to do. Let's hope that this is the first of many of these types of sessions.
I think what I found surprising here, and hopefully it's not too surprising for the attendees, but you can see we've got some print use here, but we also are stretching into some management tools like Multiverse and actually scanning. Back when we all started with PaperCut as a product, I don't even think scanning was really on the radar yet. And that's been pretty hot for at least the last 8 years or so, right?
We've got some good content coming up for scanning as well further down the slide deck. So it'll be exciting to talk about those things.
So Matt, we talked about this a little bit, and there's a lot of different ways to slice and dice the landscape, but you try to put them into buckets of small, medium, and large or complex. Can you tell us a little bit about what this means to you when you look at this from a product perspective?
Let's talk about the types of customers that we come across in healthcare. There are literally hundreds of types of customers in the healthcare space. We'll try and simplify with 3 sizes and types and the technologies they might use, or even the challenges they might face. Types of organizations are generally mostly like the cloud-based apps. They don't have a medical records application, or they might have a specialty application they use, like orthodontics have their own types of medical records apps. But I will say it's worth noting that privacy is a key driver for all healthcare orgs, regardless of the size. And that's due to generally regulatory bodies keeping a watchful eye that data isn't leaked. Medium-sized organizations, a hybrid situation with some on-prem and some cloud applications. You can see we've called out that these organizations want printing to be easy and secure. This typically becomes a factor as the organization becomes larger and more complex. This is probably traditionally what people think when they think of healthcare. Large organizations such as hospitals, these are generally very complex systems. Printing's more challenging as operational systems like EMRs or EHRs, whatever term you prefer to use, medical records apps, and their on-prem solutions. So generally that makes things a touch more complicated at times. They've got stacks of different applications to consider, and so privacy and authentication is a factor. And these organizations, as we've mentioned a couple of times, are heavily scrutinized by regulatory bodies like HIPAA. We've got some stats to talk about HIPAA as well. So the story that we want to tell here is that us collectively have got a suite of products that fit really well with these types of organizations. Small, we've got cloud-based solutions. Medium, we've got great flexibility with hybrid installs with PaperCut MF. We call this fit for purpose usually. And then large, PaperCut simplifies printing with Epic and things like that. And our product is architected, so we work out of the box in most of these scenarios. But yeah, it's pretty passionate to speak about the way we fit depending on customer size.
Well, and it's good to call out that those different sizes of healthcare. Like you said in the beginning, I think people tend to focus on the large hospital systems and how daunting of a task it can be to manage that through the sales cycle or even just through the supporting. PaperCut covers the whole span, everything from a dentist's office to that hospital, and you've got the case studies and reference material to cover that. As we drive into this, Matt, you and I talked about highlighting some of the real key conversations that are winning, increasing awareness over what our capabilities are. So what we're going to do here is talk about some key features, set a stage around what we think the 3 strongest conversations are we're having right now in this space. So visibility and security, this falls into your compliancy, but also falls into your cost recovery bucket, depending on how you're approaching your customer. Print enablement, big coverage on that topic, everything from systems that we're supporting all the way over to how we're delivering print to the user. And then digitization isn't just a healthcare thing now. It's all over, and PaperCut's taken some big strides in interoperability between different systems and integrations to their platform so the MFD has more usefulness in the user session. So we're going to dive right into visibility and security. When we were doing a lot of the conversations and research for this, I was really shocked about the one on the far right, the 63%, basically saying that healthcare organizations are concerned about data loss that their employees could be involved in. One of the biggest HIPAA violations we found when we were going through our research notes was actually a hospital in the Northeast. I think it was somewhere around 3 to 4 million. They had an employee selling PHI information outside of their system. So it's a big thing. It's not just leaving the paper on the copier, but it's also people trying to get access to that information for maybe not the right purposes. As we dig into it, we thought it'd be a good place to start about end-to-end PaperCut's vision of what it looks like to be set up in a healthcare customer.
Yeah, thanks, Rich. I can jump in from here. So it's talking about here, or it's highlighting that PaperCut is secure through the whole printing life cycle, from job delivery to traceable signatures on paper, even after it's left the exit points like an MFD. When you think about security breaches, often people think about external entities trying to grab data. It's generally not the case. It's generally internal breaches that cause the most issue. I love this story. When we first started doing really large, complex organizations as a dedicated and focused group, I remember one organization, it's actually an ACDI and an ACDI reseller customer, came to us, secure print release, and they didn't ask for print queue consolidation or anything. They actually said to us, can you please help us stay out of the news? That was what they asked for. So we spent months locking down everything in the organization so they didn't have data breaches and they weren't getting fined. They were fined twice in 1 year. That's all public information. They were most concerned about the public's perception of their data integrity. So I'll talk a little bit about this slide. So I think I mentioned around the life cycles. The cornerstone of PaperCut's features in this space are laid out in the graphic, focusing on infrastructure like authentication, security of workflows like secure print release and document output. Think audit trails and features like print archiving. If we jump to the next slide, we look at the job log. Speaking of archiving, there's a screen grab here on a job log clearly showing the first page of the job printed, who printed it, the account it was charged to, most importantly, the exit point or the printer that the job was sent to, and other important attributes of the job. A really great fundamental way to support HIPAA compliance with these types of features.
Yeah, a conversation on archiving has come up quite a bit recently, and it's not just print anymore. It's also scan for PaperCut. So you can look at those job pages that have been sent through the system as well as log that activity end to end. And we've got a little story about that towards the end. So hold tight. But before we get there, we've got Baptist Health. This is one of the more notable ones we've had for a number of years. If I remember correctly, they came in initially looking for a security type story, but wound up staying for the cost recovery and consolidation data we could provide to them that helped them manage the platform and their environment a little bit better.
Yeah, it's a bit of a scary one. We often talk about the different types of organizations that we deal with. Baptist was one of the first really big implementations we did as a coordinated team. I remember jumping on a call with about 70 different people. And that might sound scary. You've got to engage with so many different stakeholders in an organization. Fundamentally, they're trying to secure print release, print queue consolidation, queue deployment, things like that. Interesting introduction to very large, complex organizations, Baptist.
So we thought we'd take a pause in laying this out for everybody out there. Catch your breath. If there's anything that we need to throw out in the open air and address, we can do that. The chats look like they're being maintained very well. I'm getting some good questions and hopefully some good answers out there. Not really sure if there's anything we want to call out from this chat.
But I think it's really around medical records printing, which is quite a complex subject. If you ever want to lose half an hour to an hour, just phone me and I'll talk you through the complexities of medical records printing. We've got experience with most of them. It's actually a statewide site. I reckon, pretty sure that runs Meditech, and certain sites have PaperCut there. So if you have any concerns, yeah, reach out. But generally, the only major concern that you get with medical records app printing is matching the usernames that might come out of these back-end systems. Obviously, you want to get that into the print stream so you can do things like secure print release and audit trails once you're at the MFD. So yeah, please reach out. But I think Jim's got that under control as well.
Perfect. That's the one we're going to handle later from Paul. They can probably handle in the chat before we'll get to it. But let's hop into print enablement. This is a emerging topic for a lot of different reasons. For PaperCut, it's a lot of time and energy and has built an incredible solution to do a lot of different things around print enablement. But we had a hospital that we were working with, and their EPS server, which would be their Epic Print server for those hospitals that leverage that type of technology. They had built something like 70,000 queues on that system and needed to find a better way to distribute, manage, load balance. And that's literally because of how that system's architected and how every device needs to have multiple queues for different features and layers. It's a big undertaking. I think you told me, what was that?
It was 99 hours. So the story is we did a implementation in the Middle East, and it was an Oracle Health, so a Cerner customer, and we were talking about change management and how that they would submit changes to put print queues in place when they rolled in new hardware. The stat that they quoted was 99 business hours to add a queue in a hospital. 99 business hours. That's just unbelievable, isn't it? And people are trying to consolidate down into far less amount of queues to MFDs because then they don't have the cost and the time associated with these change requests with these large corporates.
Well, and check print deploy, right? So this is a big topic for us in all the industries now, but especially healthcare. Tell us a little bit about print deploy and how it's helped and what it's designed to do.
Yeah, so print deploy is about getting the right driver to a location. This feature is especially useful in large complex installs with many printers, and where users only want to see the printers that are relevant to them. And then VDI, of course, is building on that functionality. VDI adds a layer of complexity to location-based printing because you've got everything sitting behind a VDI server. VDI is building on print deploy queue deployment with the same functionality in a Citrix or a VMware environment. And PaperCut's successfully tested on just about all of the major VDI providers. But if you come across anything that you're not sure about, please reach out via ACDI and we can help you test and implement.
One of the things I found fascinating recently is the ability for IT to really connect with the endpoint through the web interface, the client apps running there. If they need to troubleshoot a print queue or deliver something new forcibly, they can do that through this interface. It's not just automation or manual choices on the user side. It's actually on the IT side as well to monitor and manage this right now.
Yeah, correct, Rich. And we've got some new content coming out with print deploy specifically in the healthcare space. It's a really clean, quick, succinct video, about 6 or 7 minutes long, talking through the different functionalities and use cases for print deploy in a healthcare setting. We're going through Final Cut now, so that should be out within a week or two.
Awesome. We're looking forward to it. Mobility is one of those pieces that's been pretty effective, especially in healthcare with BYOD and mobile device access. Matt, you want to tell us a little bit about how this works?
Yeah, if you're familiar with mobility print, this is around helping your customers printing from any operating system. So whereas print deploy is really around driver deployment, like relevant driver deployment, this is around operating system. So as per the website, Mobility Print delivers secure network print services for iOS, Windows, Mac, Android, and Chrome devices that can work with print deploy.
And deliver jobs securely from outside the firewall on Windows and Chrome and Mac, which has been helpful, especially in some of the smaller type clinics or people who have clinicians out in the field for case study work or whatever may be happening to get that job back into the environment.
I know we're going to get to a Q&A here, but there's a comment there in the chat around Hive and VDI. So not quite yet, but a lot of the focus of this organization's engineering capacity is around queue deployment in the cloud space in Hive. So lots of work and lots of great things to come over the next few months and years.
Also VDI rising up through the Hive roadmap that is an incredibly large focus on getting that delivered here within the year or the beginning of next year.
Correct.
Yep. All right. Let's move to that Q&A. Oh, no, hold on. You were jumping to Q&A and we still had to talk about these.
Sorry.
These are the two biggest EMR, EHR platforms in the world, at least from market share perspective. Epic might be leading a little bit, but we've worked with both, and you wanted to say a couple words about how this actually looks.
These systems are generally found in larger hospital systems, and they usually have a real operational role within a hospital. The basis of the functionality being the patient record. And we talk mostly when we're talking PaperCut or printing with these organizations, we focus on the printing type. So generally, if you take anything away from printing out of EMRs or EHRs, it's that they have back end and front end printing. Back end is where print jobs are generated from Epic or Oracle and they're delivered to a destination, where front end printing is like normal office printing. It's applicable for most medical records apps, EHRs or EMRs that you can see. And it's really important to notice that these systems are almost always in a Windows on-prem printing environment. What's fascinating about medical records printing is that the trend is to actually come back on-prem, or at least be hospital managed. It might be hosted in a private cloud environment, but the trend seems to be moving away from having remotely hosted and managed queues, because we talk about those horror stories of how many hours it takes to change a queue. I guess customers now these days are looking for more control and cost savings when it comes to working with these large organizations. Back-end and front-end printing, we've got lots of experience. It's actually really challenging and great fun to get into these big implementations. So always reach out via ACDI. We're happy to help where we can. I talk all day about this.
So to couple notes though, Epic used to be the app Orchard Gallery. We've got a certified app out there that may or may not be needed based on how that configuration is done at the hospital or healthcare level, organization level. Cerner has more of a hardware focus on certifications, doesn't have necessarily an app gallery or a third-party software endorsement portal. Is that correct?
Yeah, that's correct. So Epic's more platform play. They have a really great developer story. And they have a conference every year and you can go along, and they're all about people writing to their platform, whereas Oracle Health's more proprietary, so they're a bit harder to work with. Most people have to work on the periphery of Cerner, but the good thing is PaperCut works out of the box with that application.
I got to stop calling it Cerner. I have to start calling it Oracle Health.
Oh, I know. I don't think we're ready to move yet.
It's still not Cerner. This story, one of our larger regional customers that use Print Deploy and use it for VDI support. They have about 122 locations across multiple states. When the conversation actually started with them, it was around security and some cost recovery. It was color printing focused and making sure all these offices with moving staff around were not abusing the technology of the systems, but it very quickly pivoted to how do we do better with Citrix and VDI support. We were able to solve that for them and provide a lot of value in that space and continue to provide value. It's not just big complex hospitals. It could also be medium to large size regional facilities that manage everything from senior health to behavioral health to all the ambulatory stuff you might see out there. Now we're at the Q&A break. What seems like the chat's moving pretty well, Matt. I don't know if there's anything out there that we want to particularly call out. It looked like Jim address the VDI with Hive in some new A3 and A4 print devices incorporating AI, Matt, and route them for efficiency. Oh, will PaperCut be able to track device? I don't know specifically manufacturer-wise or firmware level-wise what those devices are, but we've been pretty successful being agnostic. I'd imagine if there's a play to put an app on that machine, we should be able to see it. As far as the print stream goes, we should absolutely be able to see it. So.
Yeah, you would imagine that as long as there's a username there somewhere, we're going to be able to audit that or at least play with that functionality. That'll be really interesting. I'd love to know more about that. AI is obviously the talk of the town at the moment, so we're expecting changes. What it's doing in engineering is incredible. I'd be interested to hear more from Landon at some stage.
All right, so we're in the home stretch. It's the last segment, digitization. And, I don't think for people on this call, digital transformation's a buzzword. Taking paper and other data and trying to move it into a digital space using solutions that talk to each other, that deliver data. We'll talk a little bit about the fax component and some of the scanning stuff we're doing. I think, at least for healthcare, especially maybe for the whole world, the COVID pandemic sparked this jump a lot faster, being able to collaborate on platforms that live in the cloud or in the ether versus having to come in an office and touch a sheet of paper. PaperCut's obviously invested a lot of time and energy into that particular space. There was a question on this earlier, and I saw a good answer, and we've got actually a really good case study on this too. Matt, you want to start us at this point in convenience scanning, and then we can jump to the next evolution of that, right?
Yeah, so we have spent a lot of time over the years adding to supportive scan destinations, and this list is always growing. So if you find a destination that isn't supported, please reach out to us via ACDI. Rich, you mentioned the pandemic. We had so many different inflections through that period where we were trying to get everybody to print remotely. Now we've come back to people printing back on-prem, but we're bringing the lessons and stories along that we had through remote. So it's a changing landscape, and there's no doubt that it put a lot of emphasis on digitization and scanning. Yeah. I think we moved to the advanced scan connector, right? We built this functionality with healthcare in mind. All of the initial requirements gathering were for healthcare organizations. I was a product manager that brought this feature to market. It was really around a combination of more granular control of who can send information where, but controlling the destination, or providing freedom to trusted users. We wanted to provide easy access to contacts, both shared and private, displaying them on the panel of the MFD, something that we hadn't done previously, and providing the right functionality dependent on the fax provider for things like delivery notifications and cover sheets to ensure the destination is correct and the right eyes are consuming the information upon. I think you were going to mention something about the wider scanning play now, and I was going to say a lot of those features and functionality were born from the advanced scan to fax days.
Right. At least on this slide, one of the things I'm looking forward to with version 25 of MF coming out is the email address book for multiple uses, not just fax, but also the ability to capture some of this metadata on walk-up to use in systems like SharePoint or other systems to index. So a lot of big things happening here, and it's come quite a long way. And it is one of the more requested features, especially in healthcare, the ability to walk up to the screen of the MFD and have it all right in front of you in that same session based on your login is powerful. One of our customers, part of their fleet refresh was an investment in eFax. They were trying to increase the usefulness to their users who are interacting with the MFDs all day. They actually brought in PaperCut because of our API connectivity to one of those fax solutions and our ability to provide that seamless experience. Since then, they've done some additional things with looking at other features in the product. I know they're anxiously awaiting a little bit of a email address book uplift as well. And hopefully we can get that to them soon. Closing out on this one, another large hospital system in the US. I've seen this story. It was funny when this story came about 2 or 3 years ago. It really had caught me off guard because I said, who starts talking about PaperCut because of scanning, Matt? And now it's pretty widespread with data loss prevention, cyber insurance, and HIPAA trying to plug endpoints or monitor. The story we're hearing quite a bit is all those MFDs out there, if you don't have a strategy, are connecting right to the internet, whether it's email. And if you're trying to be compliant or understand where the information's coming from and going to, it gets really challenging if every computer on the network doesn't have a monitoring tool. PaperCut actually, the way it's architected, takes all of that scan traffic, whether it's the eFax or folder, filters it up through the main server, logs it, archives it, reports on it. That allows organizations to have the visibility part, but it also is pushing down the configurations from the single server. So when a board blows out or something's happening on the machine hardware side, the configuration lives on the server. And last but not least is security access control, which means that certain users aren't going to see certain destinations. They aren't going to have access to scan to certain places. All fully logged once again and archived. It's been a strong story, not even just in healthcare now. It's coming up quite a bit in other industries too. This is our last Q&A from the feature sets. I'm going to get caught up here on the chat real quick. John Sutton, I know him. Frequency for refresh on third-party connectors. So I guess what John's mentioning is Medius became XM Fax and is now Core Fax. And they want to make sure that those APIs still talk as that product makes its changes. Do we have teams that focus on that on your side, Matt?
Yeah, we do. So the way that we architected the advanced scan to fax is that you can drop the binaries into the application folder and they'll actually just work. The functionality from device to app server is going to be the same. It's from app server to fax gateway. that might change, whether it be endpoints or such. Generally, we don't need to make changes, but if there is functionality we're missing, just bring those to us and we'll make those changes. I can't always say immediately, but we want to solve those problems as quickly as possible. We don't generally look for a guaranteed refresh over a certain period of time because of the way that it was engineered, but we're happy to help if we find that there are gaps there as well. And that goes with new fax providers. I know we've got some fax people on today. So yeah, we obviously are always looking out for those opportunities because it's a real differentiator for us to be agnostic and supportive of our fax partner friends.
Yeah, and I know, at least on our side, on the ACDI side, as well as your team order and technical services, Matt, we do a lot of work with NFRs and testing these systems. So John or anybody else, if there is a concern and we're having a challenge, let's address it, but be prepared in advance. Let's connect what we have, see how it performs, and get that back to Matt and Jim and team, and somebody on the PaperCut side can take a look at that code for us. So
yeah, and there's a couple of other things there as well that I'll take note of as well. I'll come back to the group with some answers, watermark stamped, each page scanned. That's pretty interesting. My mind goes into how we're going to do that straight away, but I think that's some cool stuff. I'm really interested in the AI, right? I know that we all bang on about AI.
so at least AI,
but,
Matt, his head's just like AI. That's where we're going to go. I got it.
All right.
So we're going to bounce over to our last couple slides. Not a lot left. I appreciate everybody's time with us today. One of the things we're going to do as a follow-up to this webinar is release some conversation starters with some meaningful information behind that question and hopefully help the teams use that in the field. We also have our teams out here that are going to meet with our resellers, partners, and hopefully plan some education, maybe some workshops around this content. And as always, we're prepared to talk with the customer directly with our reseller if needed. As information secure, there's all kinds of motivations why people bring us in. It may not be cost recovery, although Southeast, one of your case studies, had a big problem with consolidation and cost recovery and multiple vendors. And now security is the second side of that coin, right? But there's a lot of things we can help you talk to your customers about, especially in healthcare. Let us know how we can do that, and you'll see some follow-up information from us after this webinar. So Matt, this is the end of the show. Thank you for participating, and Jim and Noah and the ACDI team, Ross, and everybody out there for helping us put this together. Do you have any parting words of wisdom for us at 4 a.m, or what is it now? We're almost 5 a.m.
I can hear the gym downstairs. So obviously people are up and about, which is pretty good. If you want to take anything away from this presentation, it's that be confident in your discussions that PaperCut and ACDI will have your back. We have a lot of experience in these types of organizations, whether they be simple and nimble or whether they be really large and complex and everything in between. We've generally got the experience to help you. So be confident in your discussions. Feel free to reach out if you come across anything that's out of the ordinary via the ACDI team. We work hand in hand every day together to bring our current solutions to market and look at new opportunities for engineering and delivery as well. So don't be too scared about having the discussions. We've done it all before. The complex stuff we love. That's how we just love getting in there and helping these customers and you, the reseller. Appreciate everyone's time. Thank you. Thanks, Rich, for the opportunity to talk. If anyone wants to lose an hour or two, I'm more than happy to have a conversation about healthcare and medical records printing and AI.
Appreciate everybody's time today. The conversation continues offline now. Certainly reach out to your resources, myself, to getting our additional questions answered, and we hope to see everybody soon.